Okay, well, hello, this is Gunther Mueller. I'm going to do the webinar tonight, so thanks for logging on and joining us. What we're going to talk about is how to age healthier and live happier with hormone balance. And as you can see on the screen, we've got some words up there: age, menopause, andropause, hormones. And I'm sure you've heard some of those words before. And if we have some gentlemen on the call tonight, the andropause is the male version of menopause. So, my name is Gunther Mueller. I'm an executive physician liaison with BioT Medical. I spend half my time talking to doctors and the other half of my time talking to potential patients like yourselves on how to feel better and how to age healthier. Been an entrepreneur for about 20 years, happily married to the same woman for 21 years. I got 3 kids. Understand the stresses of life, of keeping a business going, keeping family together, being married, and all that good stuff. And just as we age, you know, how that affects our emotions and how that affects how we feel in our body and how we move through life. So we're just going to share some information tonight. Really 3 things I want you to get out of joining the webinar tonight, and that is, what do you need to know? Because there's a lot of misinformation out there in the media. And then who and what can you believe? Again, that misinformation. You got to have a trusted source to really, you know, take your health into your own hands and really decide what's going to be best for you. And then with the information I'm going to give you tonight, I'd like you to decide what you could potentially do with that information, and I'll give you some options, okay? So the best way I can describe hormone balance is really being fully present in your body. I get asked all the time, you know, what's the big deal about hormone balance? How's it going to benefit me? And the best thing I can tell you is that when your hormones are optimized and they're fully balanced, you really feel good in your body. And that's the key thing. You wake up in the morning, you feel fully rested, your brain is working, things are feeling good, and it affects every aspect of your life, financially, emotionally, physically, spiritually. So it's really important for us to feel good as we age. So a lot of people ask, what's a hormone? I can tell you that's just a chemical messenger that is running through your bloodstream. It tells every organ and every cell in your body what to do. And so they're very, very important. And I like to ask people, you know, do we lose our hormones as we age, or do we age because we lose our hormones? And I can tell you that it's both and. The answer is both. We're aging and we're losing our hormones, but we're also aging faster because we've lost our hormone balance. So we're going to talk a little bit more about that. So these are the hormones that we're talking about. Vitamin D, you see at the top of the list, and you say, hey, that's a vitamin. Well, technically it's a hormone. The difference between vitamins and hormones is that the body can produce hormone, but the body cannot produce minerals and vitamins. So it was actually misnamed when it was discovered. Vitamin D3, or hormone D3, is really responsible for absorbing that calcium that we get in our diet through our small intestine. And it's the sunshine hormone. If you were totally naked in the sun for about 20 minutes, you would generate about 20,000 IU of vitamin D3. But since we put sunscreen on every time we go in the sun, and we're living a lot indoors, a lot of indoor entertainment and stuff, we're not getting that sun exposure, and we're not creating that vitamin D3 in our skin. Therefore, as a culture in America, we are deficient. And when we do blood tests, we really see that. Thyroid, another very, very important hormone. You know, we got 52 million Americans walking around today that are not getting treated for hypothyroid symptoms because they have a normal TSH test. And if that TSH test is in the normal range, most medical practitioners are saying, you know, you're normal, it can't be your thyroid. And I'm here to tell you there's nothing further from the truth than that. We need to optimize the thyroid gland. There are a lot of chemical disruptors in our world that are really impeding our endocrine system from working well. Estrogen, everybody thinks that that is a female sex hormone. I can tell you that men have estrogen in their physiology, and we need to balance that as well. Progesterone, very important in women, protects breast tissue, uterine lining, protects the brain, a lot of protective functions of progesterone, so that's an important hormone. Testosterone, I'm here to tell you it's not just for the guys. Everybody thinks it's just a male sex hormone, and women make and need testosterone. It's super important. Cortisol is that stress hormone, that fight or flight stress hormone. It's produced in the adrenal glands. Super important hormone. Too much of it can kill you. Too little of it can kill you. So it's important to have that in balance. All right. So these are the kind of hormones that really are affecting our lives and how do we feel. So for the ladies on the call or the webinar tonight, I want to ask you to identify with any of these emotions. And most of the people, when I do live seminars like this, they start laughing and they say, yep, that's me from time to time. So this is what Hormone Havoc looks like or can feel like. And for the guys on the webinar tonight, I'm not going to let you off the hook. You really got to ask, how are you feeling? Guys, you got a short fuse going on. You got steam blowing out of your ears. You got a real trigger fuse, emotions, anger, and things like that getting out of hand. You got to ask yourself the question, how do you feel? This is the most important question. Okay, we want to feel better. And we don't want to feel like this. You know, this guy over here, you go to Waterworld and stuff like that, you see a lot of guys walking around like this these days. You see young boys walking around. This is estrogen dominance in the male physiology. We're getting female characteristics as men because the estrogen dominance is coming in our food supply, in the meat that we eat, the milk that we drink, the air. We got xenoestrogens from building products and carpets and different plastics and things like that in our environment. I can tell you we've added 70,000 new chemicals to our world since the Industrial Revolution began, and we don't even know the beginning of how those chemicals are really affecting our physiology. The ladies here having headaches and things like that, going through the ibuprofen bottles, not a good thing. And then somebody always seems to sneak this into my slide here. I'll let you figure out what that is, but I'm sure you're aware of the blue pill and the white pill and all the commercials on TV, talking about this issue. It's real, and a lot of people are suffering from it, and we can do something about that. For the guys, this is andropause gone wrong. The only one that's got it right in this picture is the dog getting its exercise, right? Sitting on the couch, not feeling like doing anything, drinking whatever he's drinking there. Not a good way to go through our older adult life, all right? We kind of want to feel like this, and this is just stock photography saying, hey, I'm calm, cool, collected, I'm kind of chillaxing, feeling good in my body, I'm aging well. This is kind of what we're solving for. So let's talk about some of the symptoms. I can tell you that the #1 symptom that patients are presenting with to their doctor is, Doc, I'm tired. I hit this wall at 2, 3, 4 o'clock in the afternoon. I got to go to the Starbucks. I got to drink a 5-hour energy shot. I need a Red Bull. I need something to keep me going through the day. Mood swings, anxiety, tension, irritability. How many times you're waking up in the middle of the night for no good reason? 2, 3, 4 o'clock in the morning, you're waking up. How many times you walk into a room, can't remember why you walked into the room? How many of your friends do you know that are on antidepressant medication? How many times do you feel like you can't focus on a project? Brain fog, no mental clarity. These next two are really important, hot flashes and night sweats, okay? For the ladies on the call, I want to tell you that a technical hot flash starts in the chest, flutters up to the head, comes back down, lasts about 45 seconds or a minute, maybe a minute and a half. Everything other than that is not a technical hot flash. It is a night sweat, and there are 2 different hormones associated with these symptoms. So your hot flashes are really related to estrogen deficiency, and your night sweats are related to testosterone deficiency. And the night sweats are really just that feeling of I'm hot. I'm kicking the covers off at night. I want to turn the ceiling fan on, turn the air conditioner down, kicking your husband or your spouse off yourself and just saying, look, I'm hot. Leave me alone. That's testosterone related. And the night sweats don't just happen at night. They can happen at any time during the day. Weight gain, we're all concerned about that. We'll talk about that a little bit. Joint pain. How many of your friends do you know that their joints are starting to ache and creak, and we see knee replacements going on, hip replacements, all this stuff? We can do something about that with optimizing our hormones. Migraines, headaches, bladder symptoms, incontinence, things like that, and of course that decreased sex drive and performance issues. So if any of these symptoms are sounding familiar, stay on the webinar here. We're going to talk about some solutions, okay? And this is really why we need to talk about hormones. If you have some loved ones out there that are suffering from those symptoms, direct them to the webinar, hormonehealthwebinar.com, have them register for the next session, or come to one of our live seminars and go back to the doctor that referred you to this webinar to find out when the live sessions are. And the people that you really care about, they may be suffering from these symptoms. They really need to get this education and make a good decision for their health in the future to age healthier, okay? So now I'm going to tell you a little story about Carol and Ann. These are 2 twins, as you can see in the picture. They're young and healthy and vibrant and everything, and so they're going to age a little bit. Maybe the twins are going to have a couple babies. At age 35, these twins are suffering from the same symptoms that many, many, many women in our culture are suffering from: depression, anxiety, irritability, mood swings, fatigue, weight gain, low libido, sleeping difficulties. And Carol and Ann are going to go 2 different routes. Okay, Carol's going to visit her primary care traditional practitioner. Ann is going to seek out someone who is a hormone expert. And you're going to see that their life is going to be very different. So Carol's going to get a very quick consultation with her doctor. And because she's not feeling good and her blood work looks quote unquote normal, she's going to get put on probably an antidepressant, some Wellbutrin, some Prozac, and the doctor's really going to fail to mention that this is really going to help you gain weight and it's going to whack your sex drive. So Carol's not going to be feeling very good. Ann, on the other hand, has an in-depth consultation, detailed blood work, a real analysis of her health history and the symptoms that she's dealing with, and her doctor finds out that, man, she's suffering from a testosterone deficiency, which is rare because most women don't even get tested for their testosterone levels anymore, or ever. So that's what we're doing different at BioT Medical here. We're really checking testosterone in women. And Ann finds out she's got the deficiency. She gets treated for that. So let's add 5 years to the deal here. Carol's now still overweight, no sex drive, no energy. Doctor prescribes what? A diet pill, maybe some Ambien and Lunesta so we can sleep at night. You know, we're almost at a place in our culture where we need a pill to wake up, a pill to go to sleep, a pill to go to the bathroom, a pill to stop going to the bathroom. It's just getting really out of hand that we need a drug for everything when really the root cause of our symptoms are hormonally related. And on the other hand, she's been on BHRT, it stands for bioidentical hormone replacement therapy, for the last 5 years, and she is feeling great. So the twins are now 40. Let's add 5 years. 45 years old, Carol comes to the doctor with all the same symptoms, but now we're going to do some lab work, and we're going to find out that, oh my gosh, the cholesterol number is way up, so we got to get some drugs for that. Maybe we need some Crestor, we need some Lipitor because, you know, we're afraid of getting heart disease or a heart attack. You know, I can tell you that there's never been a study that really links high cholesterol with heart disease or heart attacks. Not out there. Look for it. See if you can find it. It's not there. So really, but that's modern medicine today. We're all concerned about the cholesterol number, and we're using patented prescription drugs to try to lower that number. And they all have kinds of crazy side effects like these: liver damage, muscle breakdown, kidney damage. Extended use of these statin drugs really do have some serious side effects where you really don't feel like doing anything anymore. You just you feel like sitting on the couch and kind of just sitting there watching TV. You don't feel like going out and exercising and doing the things that you used to love to do. All right. So add 5 years to the deal. The twins are now 50 years old. Carol's now on 7 different prescription medications, and at about age 50 is when traditional medicine starts talking about or thinking about hormones. Unfortunately, they think and talk a lot about and prescribe a lot of synthetic oral hormone. You guys have all heard about Premarin, right? That's pregnant horse mare's urine. We've been using that for close to 60 years now. It was invented in 1942 or longer, 70 years now. A whole host of side effects with that we've seen over those years, and it's really not a great thing to do. We'll talk more about that in detail. And she's still aging healthier, living happier on bioidentical hormone replacement therapy. At 55, you know, Carol stops taking those hormones because she read the headlines. She's nervous about the side effects of not bioidentical hormone replacement therapy, but synthetic hormone replacement therapy is what really brings all the side effects. Her practitioner now does some more blood tests or a bone density scan, finds out she's got high blood pressure, maybe get type 2 diabetes going on. It's almost epidemic in our culture. People coming down with that left and right. And then we got some bone density issues, so we might need some Boniva, some Fosamax, some of these bone building drugs that really just build very brittle bone. They don't build healthy bone. Your bones are supposed to be able to flex a little bit and take a hit and not break right away. But when you're on these bone building drugs, you know, you step off the curb the wrong way and you crack a femur or break a hip. This is not natural. This is not the way we want to be. All right, so at age 60, you can see the difference in the twins here. Carol's practitioner has really not understood the importance of hormone balance as a method or a method of attacking the root causes of the symptoms that we as a culture are presenting with. Okay, very important. You know, modern medicine today, what we're doing with all these patented drugs is really just treating the symptoms, putting Band-Aids on the symptoms. We're not treating the root cause of these issues and symptoms and diseases that we're coming down with as a culture. So at age 60, Carol's tired, depressed, overweight, irritable, can't think, no sex drive. At age 60, Ann feels great, looks great, has an amazing sex drive. Every time I look at her picture there, I think she's kind of flying around the world in a biplane or something, having a good time. Okay, so you got to ask yourself, which story would you like to tell? And I can trust that you're probably going to say, I want to be more like Ann. So at BioT Medical, we really feel like, you know, traditional medicine has failed Carol, and we're about the business of changing the paradigm of medicine, getting people's hormones optimized earlier in life rather than later. This screen here just shows you that some of the leading causes of death, and we can do something about these major causes of death with hormone optimization. We can do something about heart disease, cancer, cerebrovascular disease, not so much on the respiratory issues. All these unintentional accidents and injuries are probably coming a large part from all the drugs that we're on and the contraindications of all these drugs, that we're not thinking clearly when we get into our car and we drive and we have accidents, or we wake up at 2 o'clock in the morning to use the bathroom, we're dizzy from our Ambien, we slip on the floor, crack our head on the bathroom, on the bathtub or something, we got to go to the emergency room. That's what we mean by a lot of these unintentional injuries. Diabetes, we can do something about that. Alzheimer's disease, I'm going to show you we can do something about that. And the last two here, not so much. Okay? Fifth leading cause of death in the United States right now is prescription medications taken as prescribed. I'm not talking about prescription drug abuse. I'm talking about taking them the way your doctor told you to take them. We have 2.2 million people per year having an adverse reaction to drugs in the hospital. And we've got 7.5 million unnecessary medical surgical procedures performed every year in the United States. It's almost like we've gotten to a culture of if the parts aren't working, let's just tear them out. Let's just take them out, instead of treating the root cause of how to get our bodies functioning and working better. All right, so this is a huge statistic here, the jump from premenopausal to postmenopausal for women. This is the decline of estrogen in the female physiology, which estrogen, I'm going to show you, is very heart protective. Okay, so big jump from 1 in 7 to 1 in 3. Heart attacks and heart disease are real for women. We don't talk about it a lot, but it's a real issue, and hormone optimization can really protect you from that outcome. So estrogen, really responsible for 400 functions in the body, controls those nasty hot flashes, and you see it's a very maintaining type hormone. Maintains bone density, maintains collagen in the skin, helps maintain the memory, right? Really increases the serotonin, the dopamine production in the brain. That's those happy, feel-good hormones. And just so you know, if you're smoking and you're stressed out, it's going to affect your estrogen balance in your body. And stress really is the #1 hormone disruptor that we have as a culture and as a society. Super important. We all live very stressed out lives, whether it's financial stress, familial stress, all different kinds of stresses are affecting our hormone balance. Okay, so estrogen, very important as women age. Super, super important. Testosterone, like I said, everybody thinks it's just for the guys. It's not. Women make and need testosterone. And what this is showing you here, that men are losing it much slower than the ladies. You know, this is over a long period of time, from age 30 to 70, losing it maybe 3 to 5% a year, 1 to 3% a year. Women, on the other hand, usually after a couple pregnancy cycles, lose maybe 50% of their testosterone production between the age of 20 and 40. And this really affects how they feel. And testosterone is a master hormone, major hormone, protects the bone, the brain, the breast tissue, heart, and your joints. And we say relationships. It's super important because, testosterone affects that desire center in the brain. And, relationships tend to go better when there is desire in the relationship. So hormones directly affect that as well. And we always recommend for couples to consider getting pelleted or getting their hormones optimized together so that they're on the same page. Okay? And everything I'm going to show you from here on out is really backed by medical studies. This is not my opinion. This is not BioT Medical's opinion. And it's not the opinion of the doctor that brought you to this webinar. This is based on 75 years of peer-reviewed medical literature from all over the world, which I'm going to share with you now. The studies that point to, hey, optimizing hormones earlier in life are really going to be beneficial to how we age. Okay? So now that we know that we need hormone in the body, these are the chemical messengers that are really directing our body, our organs, and our cells to be healthier and to age better. You got to make a choice as to how you're going to get that hormone into the bloodstream, because that's where it's got to go. And so you can use the synthetic route, which I don't recommend because the body does not recognize synthetic hormone as homemade. It has to go through a process, and you get some of the effects, and you get some of the toxicity load, and a lot of the side effects with synthetic hormones. Bioidentical is where we're at with BioT Medical, and I don't really even like that term because our own FDA doesn't even recognize that term. They think it's just a marketing term, but what we mean by that is we mean human identical hormone, meaning the same exact molecular structure of the hormone that your body has been producing all of your life is the same hormone that you should be introducing to your body in one of these modalities: pills, patches, creams, gels, troches, and pellets. And we're going to go through those right now. This is a great piece of wisdom right here before we start going into that. There is no one-size-fits-all approach, okay? Hormone balance is an individualized approach. It must be individualized for both men and women to make sure that it works. So keep that in mind as we go through this. So if you're going to take your hormones orally, which is, by the way, the worst way to take your hormones, because hormone was not meant to go through the liver. Okay, and that's what it has to do. It goes through your intestinal tract. It has to be processed through the liver before it gets into the bloodstream. And our bodies have about 1 billion chemical reactions going on every second of the day. And truly, we don't know how your biochemistry is going to really digest and metabolize and get this hormone into your bloodstream. Hence the list of kind of nasty side effects that you can possibly have from taking oral hormone replacement therapy. It is the least favorite way. Progesterone really is the only sex hormone that is safe to take orally. We highly recommend bioidentical compounded progesterone. If you're going to be taking some progesterone, make sure it's bioidentical, make sure it's compounded, and that it is precise in its dosing. Okay? So a little joke here, because we've been doing Premarin for so many years. The horse is saying, "You're going to give me human estrogen?" I don't think so. So if the shoe were on the other hoof, that thing would not go down. I'm sure, ladies on the webinar here tonight, you've heard of the Women's Health Initiative. All these adverse side effects here, really, really scary from taking what? Oral synthetic hormone, either estrogen or progesterone, or better known as progestins. It's very important to differentiate the difference between bioidentical, human identical, and synthetic hormone. Okay, so, and we really think the Women's Health Initiative was really testing the wrong drug, the wrong dose, because it was a one-size-fits-all approach, and it was the wrong route because it was oral. And it really took $1 billion of our taxpayer dollars to figure this out. We already knew this, but that's kind of the way our government works. So if you're not going to take hormone orally, you can take patches, okay? Stick them on your hip, on your shoulder, on your back, in your thigh, different places. And I always figure, if I was going to get my hormone, with patches, and what happens is the skin gets desensitized and you can't absorb hormone through the skin after a while, so you got to move the patch around. And I figure, if I live another 40 years, I need to find a place to put this patch, and I'm probably going to run out of skin. The other issue here is that 45% of the people do not absorb hormone through the skin, and unless you're doing the proper follow-up lab work, you really don't know if those patches are actually changing anything in your blood levels, in your physiology. Okay, kind of inconvenient, because you got to change the patch about every 3 days. You got a little bit of an adhesive problem. It gets sticky, it gets a little messy. If you get it wet, it kind of falls off, or if you get sweaty, it comes off. So it's not the most convenient way to get hormone into your bloodstream. So then a lot of people are using creams and gels, and you got to ask yourself, who's doing the dosing? Did you apply enough? Nickel size, dime size, quarter size, $half size? Did you rub it in completely? Did you let it dry before you put your clothes on? How much of it is actually getting through your skin, right? This is what we got to be concerned with the inconsistency of the dose when you're using creams and gels. The other thing here is transfer to others. This is super important. She doesn't need his testosterone dose, and he doesn't need her estrogen dose, and your kids certainly don't need your hormone dose. So skin-to-skin contact, very important to monitor that. It does affect babies and pets as well. And most important here is the products that you're familiar with, the biased creams and this, the mass-produced pharmaceutical drugs. They do not have the bone, heart, brain protection that pellets offer, and this is proven in the studies that I'm going to show you here, okay? This is an example of a cream that a lot of guys are using. What this is showing, that the average male in our society, maybe 40, 45 years old, is showing up with about a 250 testosterone level, maybe as high as 300, somewhere in this range. And what you have here is two dosing options, a 50 milligram and a 100 milligram dose. The red is 50 milligram. The orange looking color here is 100 milligram. And it's showing with good patient compliance, this patient might get a 150 or 200 point bump in their total testosterone level. Well, we know that men under 500 are more prone to not feeling good, at a higher risk for heart disease and things like that. I'm going to show you another slide on that here in a minute that proves that out. But this cream is expensive. It's maybe $350 a month, maybe $70 or $80 with health insurance, and it doesn't smell good. So to me, that's a triple whammy deal killer. It doesn't work that good. It's not getting you to an optimal level of testosterone. It doesn't smell good, and it's expensive. So I'm going to show you a better way to get hormone into the bloodstream. A lot of guys are doing this. For the gentleman on the webinar tonight, injectable testosterone kind of makes you look like this, right? Because if you're doing it once a week, you feel good for 3 days and you feel crappy for 4 days. And that's not a good way to go. Significant roller coaster ride, uneven absorption, and guess what? This is a synthetic form of testosterone. This is not the way to go, okay? Because synthetic testosterone creates some liver toxicity issues, can create some heart disease, cardiovascular issues, prostate cancer. It has the opposite effect on our lipid panels, on our cholesterol levels. So that's not what we're solving for. This is not a good way to go, but a lot of people, a lot of guys especially, are out there doing testosterone shots, and really, I'm going to show you pellets are a much, much better way. Okay, so let's talk about the pellets. Completely natural. They're non-synthetic. We derive the compounds from wild Mexican yams, but if you have an allergy to yams or soy or anything like that, it doesn't apply, because all we're doing is taking the carbon, the hydrogen, and the oxygen atom to make the molecule known as testosterone, to make the molecule known as estradiol, and we make it completely identical to that same molecular structure as human hormones have. This is the only modality that can last you 4 to 6 months, and it is the most widely studied form of hormone replacement therapy. There have been more studies done on pellet therapy than any other modality combined. Okay, so lots and lots of studies over the last 75 years showing the effectiveness and the safety of pellet therapy. So what do pellets do? They provide a steady stream of hormone to your bloodstream, 24 hours a day, 7 days a week, even steady state dose on an individualized basis now. This dose is determined by your blood work, by your health history, and by the symptoms with which you're presenting to your doctor with. All of that goes into a proprietary dosing site, and at BioT Medical we determine the dose for our doctors. And really, this is based on over 250,000 procedures that we've done. Our founding physician, Dr. Gary Donovitz, has personally pelleted over 44,000 people. So we've got about 34 years experience now in knowing how to dose hormone with pellets in both men and women. And it's inserted under the skin. Everybody reach around, feel that little fatty part on the upper part of your butt, on your hip there. There's a little cushion right there, and that's where the pellets go. They're about the size of a grain of rice. Procedure takes about 15-20 minutes. It's completely painless. They numb the area with a little bit of lidocaine. They do a very small incision, and they put those pellets in there, and they pull out the trocar, is the device that they use, and put a little steri-strip band-aid on there, a little gauze, a little band-aid, and some ice on there just to chill it down, and you're in and out of the office in about 20 minutes. So very easy procedure, no scarring, no stitches, no pain, and very, very easy to get your hormone dose. And so here's how it kind of works, right? If you're on orals, you're getting your hormone dose. You have hormone, you don't, you have it, you don't, you have it, you don't, you have it, you don't. That's not a good way for the brain to register whether it has hormone to repair the body. Patches, you're riding a roller coaster, you're building in strength for about a day and a half, and then you're coming down for about a day and a half. You change the patch over here, and you're back on the roller coaster ride. I don't have shots on here, but the shots would kind of be a huge spike, fall down, huge spike, fall down, huge spike, fall down. And a lot of times you fall down lower than where you started out on the shots. The best way to get hormones is the implant or the pellet, because it's a steady state, even hormone dose, 24 hours a day, 7 days a week. It is your precise, individualized dose delivered to you the way the body is used to receiving hormone. That's directly into the bloodstream. Hormone is not meant to go through the muscle tissue. It's not meant to go through the fatty tissue, and it's certainly not meant to go through the liver. And so the implant most resembles how the body is used to absorbing hormone. And if you think for a second that you're a guinea pig or something like that, and you never heard about this and you haven't seen a TV commercial about it, you're right, because this is not patentable and has been around since 1939. The pellet was invented for women that had radical hysterectomies that needed to get estrogen back into the bloodstream, so that's where this 75 years of research has been done. It's widely used in Europe and Australia. This is the way they optimize hormones overseas. Okay, super important to understand that. You're not a guinea pig. And the television set is not a great way for you to get medical advice in the first place. You know, it was 7 or 8 years ago that drug companies were able to entertain doctors and take them on fancy trips. That changed. So now they're investing hundreds of millions of dollars to get you to ask your doctor if this drug is right for you. And as you've seen on TV, all these drugs have 15 to 25 different side effects, including death and that's really not a good way to go either. Okay, so here's that chart I was telling you about. I don't have it for the women, but I have it for the men, because really I don't do testosterone studies on women, but we know from clinical observation that testosterone at an optimal level really helps women feel better. But I'm going to show you the comorbidities associated with low testosterone in men. What you see here is the range on a typical lab slip is between 200 and 1100 is kind of the range. What you're seeing here is that if you want to do something to protect the brain about Alzheimer's, from Alzheimer's, you got to be over 900. If you want to do something about osteoporosis, you got to be over 700 if you're a guy. You want to do something about coronary heart disease, you've got to be above 300, 400, 500. Remember, I told you that men are not going to feel good below 500. That's because fatigue and libido loss and type 2 diabetes and look, depression down here is a function. If you notice, erectile dysfunction is way down here. You got to be super low for that to be the issue when it's related to testosterone. Okay, so you can see it's important to have an optimal physiologic dose of testosterone throughout your life, not just when you're 15 or 20 or 25 years old, but when you're 30, 40, 50, 60. This is about living decades of your life in an optimal physiologic state. Okay, to what? Age healthier and live happier. Okay, so let's get into some of the medical studies here. This is the STUD study, 1990. What it's showing you that pellet therapy gives you 8.3% healthy bone growth. This is how we're going to do something about osteoporosis and osteopenia. And you don't want to wait till you're 50, 55, 60 years old to get your hormones checked. You want to live at an optimal testosterone level so that you're always building healthy bones, so that you have more bone growth than you have bone death. And you can see if on patches you're not doing as well, you're losing about 3.5% bone mass per year. So with patches you're kind of breaking even, and if you're on oral estrogens, which we don't recommend at all, you're only building about 1 to 2%, which is not enough. All right, so very important study here. They've done the study 3 times, same result every time, that pellet therapy gives you really healthy bone growth. Everybody's concerned about breast cancer. You know, estrogen causes breast cancer. That's the common thinking out there. Well, that's kind of true, and it could be true with estrone, which we call the bad estrogen. But in the Women's Health Initiative, they were giving synthetic estrogen. They were giving synthetic progesterone, progestins, right? But no testosterone. What do we find here in the Nurses' Health Study? That estrogen plus testosterone, no increased risk of breast cancer. That's because testosterone opposes estrogen. Testosterone downregulates the receptors in the breast tissue, and you have to have balance. Our number one thing here at BioT Medical is that balance is everything. Estrogen needs to be balanced with progesterone, needs to be balanced with testosterone. We need to live in a state of balance. And so we can do something about protecting the breast tissue. All right? Archives of Internal Medicine. All right, this is showing us the same thing, that non-oral testosterone prevents the stimulation of the breast tissue and lowers the risk of breast cancer. The oral synthetic or methyl testosterone increases the risk of breast cancer, and that's what you find. You're really not supposed to take testosterone orally, but these are common, popular, name-branded drugs that people have been taking for years, and that's why you see all the bad news in the media that hormones, oh my gosh, you got to be careful because they got all these nasty side effects. That's true when you're using synthetic oral hormone. Not true when you're using pellet therapy and you're getting your individualized dose. It's actually breast protective. Okay? Breast cancer studies, literally there are hundreds of them, that testosterone is breast protective. Okay? It balances the estrogen that you have in your body, and even for breast cancer survivors, very important to help them feel good after they've gone through rounds of chemotherapy and all the regimens that go with fighting cancer. It's really good to get your testosterone level back in shape so that you can feel good and live the rest of your life much better. Neurology journals here showing us that women 8 to 1 more likely over men to get Alzheimer's disease. Men with low testosterone 3 times more likely to develop Alzheimer's disease. Why is this? I'll tell you that testosterone is a vasodilator. It brings more nutrition, more oxygen to the brain. This protects the myelin sheath on the nerve endings so that those nerves don't short circuit over time. Remember I said if you ever walked into a room, forgot why you're there, that's the beginnings of Alzheimer's disease. Now you live out of hormone balance for several years or decades, and that's just going to get worse. Can we reverse Alzheimer's? No, but we maybe can stop it a little bit in its tracks, but if you start early enough, you can do something to protect the brain from atrophying in that sense, okay? 1993 here, British Journal of Hospital Medicine. Remember those blood clots? Well, with pellet therapy, no increase in blood clot activity with pellet therapy, reduces cardiovascular risk compared to oral therapy, does not increase the risk of breast cancer incidence. So I hope what you're seeing is studies, from different decades, different times, different countries, kind of all pointing to the effectiveness and the safety of hormone replacement therapy when you use pellets and when you use bioidentical hormone to do that. This is the Susan Davis study really talking about pellets and the effect it has on our lipid panels, our cholesterol. So we're decreasing the LDL, we're increasing the HDL, and we're decreasing the triglycerides. This is really, really important because I showed you the synthetic form of shots and things like that has the opposite effect. Okay? So by 2020, our government is telling us that osteoarthritis will be the 4th leading cause of disability in the United States, and that's not a good thing. How many of your friends do you know that have those achy, creaky joints? Excuse me for a second while I cough. Okay, I'm going to mute myself. All right, I'm back. So both estrogen and testosterone, really, really beneficial. We have testosterone receptors in every joint of our body. We have receptors in the, in the heart tissue and the brain tissue, but really in our joints. And so we can rebuild bone, we can rebuild cartilage, we can really help with arthritis and rheumatoid arthritis. The studies are coming out to show that as well. And if you don't do something to your hormone levels and do something about it, this can be your future. All these happy little scooters and carts and customized bathtubs and things like that, because our body is just not working anymore and we get to go around the grocery store in one of these carts. I can tell you there's a better way to age, and that is to get your hormones optimized, at least get your blood work done. That's where it all happens. Find out where you're at and figure out if this can be beneficial for you. Prostate cancer studies, there was a huge myth in medicine for about 35, 40 years that testosterone caused prostate cancer. I can tell you just logically, that nothing could be further from the truth than that, because if it was true, then every 20, 25-year-old guy would be at risk for prostate cancer, and that's just not true. So luckily there are more and more studies out now in the urology field and everything that testosterone is actually prostate protective. What they're seeing is that it's really estrogen dominance in the male physiology that's causing the growth of the prostate gland and leading to what we call prostate cancer. So earlier in life, testosterone, very, very beneficial for the male physiology and for protecting the prostate gland. Okay, this is a really cool statistic here. It's a great book if you want to read a great book just on modern medicine and really the addiction we have to pills and big pharmaceutical drugs. We always think that the American healthcare system is the best in the world, but really it's ranked 29th. Okay, oops, I goofed there. It's ranked 29th among nations. Okay, what I can tell you is that it's the most expensive healthcare system in the world. So you really want to think about that in how you want to treat your health. Okay, so I'm sure everybody on the webinar tonight uses a car, and I'm sure that you put more than just gas in your car. Otherwise, your car would probably look like this. You got to wax it. You got to change the tires. You got to do oil changes. You got to change the transmission fluid, right? Because you kind of want it to look like this. This is the way you want your ride to look. And again, we're using the analogy of our physical body as our vehicle to get around life. And if you don't do something different, you're going to wind up looking like this. And this is probably not the outcome that people on the webinar tonight are solving for. So I don't want you to get to the idea that you put some pellets in your behind there and you're going to have a red S tattooed on your chest tomorrow morning. You're going to be able to leap over tall buildings in a single bound. There's a little bit more to the therapy to really getting yourself optimized. One of the supplements that we're very keen on here at Bio2 Medical is DIM. Very important. It's, your mom always said, eat your vegetables, right? So this is your broccoli, your cauliflower, cabbage, Brussels sprouts, things like that. And what's in a little pill is like 7 pounds of broccoli. You just can't eat that much. So this is really beneficial in metabolizing estrogen out of the body. It helps free testosterone. It's a mild aromatase inhibitor, and your doctor that sent you to the webinar tonight can tell you a little bit more about that. But so we need this supplement to really round out and to help the hormone therapy work well. Another great supplement that we've developed at Bio2 Medical is what we call ADK. It's 5,000 IU of A, 5,000 IU of D3, and 540 micrograms of K2. These are really 3 fat-soluble vitamins that work together in harmony. As you can see the guys in the picture there, that is a delicate balancing act. And so vitamin A, D3, and K2 really work together that way. K2, if you've never heard about it, is the vitamin that is responsible for putting calcium into the bones and the teeth where it belongs. And if you're deficient in K2, you can get calcium laid down in the coronary arteries, in the heart, and this really research is pointing to is really the real reason why you get that first surprise heart attack. Calcium buildup in the coronary artery gets tied in with the plaque production. A piece of that breaks off. You can have a heart attack. You can have a stroke. K2 only found in grass-fed animal protein. This is very important. You don't get K2 vitamin from vegetables. You don't get it from fruit. You don't get it from dairy. You only get it from grass-fed animal protein. So we really have to supplement it in our culture. Okay, you're going to hear a lot about that in the next 10 years. So, take home here on thyroid. Like I said, we got 52 million Americans not being treated for their thyroid or hypothyroid symptoms. I can give you a list of low testosterone symptoms and a list of low thyroid symptoms. They're almost identical. So what you need is a doctor who's been trained to look at your labs in a new way, your blood work in a new way, to really ask you questions about your medical history and what the symptoms are that you're dealing with, and really paying attention to the symptoms. What we're doing here is we're not treating the lab slip. We are treating you, the patient. We're treating the true root causes of the symptoms that you're having. And we're balancing all of the hormones. This is not just about jacking up your testosterone level. This is about estrogen, testosterone, progesterone, thyroid, vitamin D3, which I told you is a hormone, B12, very important to energy production in the cellular level. So patients that are not feeling well, not losing weight, fatigued and all that, thyroid plays a huge role in that in every cell in the body. What we need is a holistic approach to maximizing hormones, and it does require a little bit of nutritional and mineral support in addition to the hormone therapy, okay? So I've given you a lot of information. I want to wrap it up for you here, but hormone imbalance can happen at any age. Okay, it starts with a blood test. We don't have a crystal ball. We can't look at you and tell you that you're a hormone patient. We got to look at some blood work. We got to ask you a lot of questions about your symptoms, and that's what your doctor is more than willing to do. You know, the doctor that sent you to this webinar tonight and educated you about coming to hormonehealthwebinar.com. So hormone balance is not a one-size-fits-all approach. I hope you got that from seeing the other modalities and how they behave. This is individualized dosing. The doctor that sent you here, you have over 1,000 different dosing combinations to get your individualized dose. And then on the very bottom here, this is super important. We do not want to be normal, okay? We want to be optimal. How many times have you gotten your blood work done, got a call from your doctor saying, look, everything's normal, you're okay. And then you're thinking in the back of your mind, well, doc, I came to see you because I got all these symptoms. I'm feeling not good. I'm feeling crappy. And you're telling me I'm normal. Well, what am I going to do about that? Well, go see your BioT certified practitioner. He's going to get you straightened out, going to look at your blood work in a new way, going to figure out the root cause of the symptoms that you're dealing with, and optimize your vitamin D, your thyroid, your estrogen, your testosterone. This is the source of good health. Okay, so we don't just want to live, we want to be alive. We don't need all these pills and drugs that they're getting pushed on us on the TV. They all have 15 to 20 side effects. That's really not the way to go. And here's what patients are saying. They get their hormones optimized. They get some testosterone, they get some estrogen, they get their thyroid balance, increased energy levels, restored interest in life. That's that mental clarity, this zest for life, you know, waking up in the morning and knowing why you're here on the planet, and then having the natural energy to go out and do the things that you want to do. That's what this is all about. Increased sex drive, consistency in moods. I can't tell you how many people we get off their anti-anxiety and anti-depression medication. We have a protocol for that. Mental clarity is one of the biggest benefits. Sleeping better at night. And then, yes, we can help you with some weight loss, you know, that decreased body fat, because why? Testosterone helps you build lean muscle mass. And for the ladies on the call, I just want to say, don't be so concerned about what the scale says. Actually, you may have to just throw your scale out, because the most important question is, how do your clothes fit? When you get your hormones optimized and you get some exercise and you eat right and you get some nutritional support and minerals and things like that, you will see that fat weight starts shifting around and you start building some lean muscle mass, and your clothes are going to fit better. But lean muscle mass weighs more than fat. So the scale may actually say that you weigh a little bit more, but guess what? You're feeling better, the body's working better, your joints don't hurt, your mind is clear, you feel rested when you wake up in the morning. that's a greater capacity for getting the body in shape and really leads to this abundance in life. That's what we're about here at BioT Medical, and that's what your doctor is about that sent you to this webinar. Okay, so what is the therapy in a nutshell? We're not jacking your hormones. We're bringing your body back to an optimal physiologic state, kind of like when you were 28 or 29 or 30 years old and you were feeling good. That we're going to try to bring you back to that level. We're going to do it by using the right kind of hormone, bioidentical hormone, human identical hormone, same molecule that your body's been producing all your life. We're going to do it in the right amount. We're going to use individualized dosing based on your blood work, based on your symptoms and your clinical history. Okay, and then we're going to use the right delivery system. We're going to use pellets because that's what most resembles how the body is used to absorbing hormone. Okay, the patches, pills, and the creams, that's not the way the body is used to absorbing hormone. The pellet is hormone directly into the bloodstream. We're not going through the fatty tissue, the muscle tissue, the liver. Okay, very, very important to understand that. So we got about 80 years experience in doing this on 5 continents, great long-term safety record. Our logo at BioT Medical stands for Best in Outcome. The T stands for testosterone. The E stands for estrogen. And again, remember your BioT certified practitioner that sent you to this webinar tonight. Go back to them, get your blood work done. That's where it all starts. And this really is my favorite slide because it shows the complexity of hormone optimization. It shows why you need to seek out a practitioner that has been trained and has been certified on how to optimize hormones. So we're going to optimize your sorry here, messed that up, but your testosterone and your estrogen and your thyroid. These are inexpensive to get optimized. You've heard of human growth hormone? Well, that's important, but if you're going to go get human growth hormone shots, you're going to spend maybe $500 or $600 a month. It's going to take 5 or 6 months for you to realize the results of that. And what we're saying here, let's optimize these 3 hormones and your progesterone and stuff, and maybe your pituitary gland will get reactivated and produce your own human growth hormone. And then we're going to add some vitamins, minerals up here, some nutritional support, diet, lifestyle, and exercise, very important. So you can see this works like a complex Swiss watch when it's all working together, all to do what? Get you back to an optimal physiologic state of health so that you can age healthier and that you can live happier. That's what this is all about. So I would like to see if there are any questions on the question board here. That's what I'm going to look for here. Hold on one second. I'm going to see if anybody posted any questions. And I don't see any questions in the chat box, so I guess we're good to go here. Thank you so much. It's been about 50 minutes on the webinar here. Thanks for attending tonight. Please go back and talk to the practitioner that sent you to the webinar tonight. Share it with your friends, hormonehealthwebinar.com, or get them with the doctor that sent you to this. Start with getting a blood test, figure out what your baseline is, see where you're at, and then hopefully make the choice to really optimize your hormones and age healthier and live happier. Thank you so much. Have a great time. Have a great night.